muscular component, which of course is sensitive to the nervous system and to hormones like this. Anyway, if the valve sticks open, you can have all kinds of things. It can act like a GI infection. People actually feel foolish. There can be, it can be just out of the blue. They just feel really sick and feel achy all over. A lot of times they have shoulder pain. A lot of times that's what brings them in, because people don't come into me a lot of times thinking that they've got a problem. Because they got a bone joint. Often it's the there's a link to an article. McBurney's point, kind of a classic for appendix. That's the point you can use to TL. It's about halfway between the umbilicus and ascites. Really, it's about, most people, it's about 2/3 of the way, umbilicus to the ascites. Way down in there. And on the right, unless they have what's they call organ retroversion, which I've had a couple patients that have that. They have it. You know, I mean, where the organs are turned and they're, you know, their ICV could be clear over here. But I guess it's kind of rare. So these are with an open ICV, which is more common. These are the hotspots. These are the things that we'll be using to both diagnose and to treat. We've got and see the right shoulder. A lot of times, right shoulder pain, tendonitis, kind of stuff is secondary to ICV. So you got Bennett point. Strangely, here's the only other Bennett point that is not on the head. Then you have Chapman point a little bit lower. Those will TL. The bicipital groove area a lot of times will be really high. You can have subluxations at C5 below L1. It's pretty common. Also, zygomatic sutural cranial fault. We haven't done it, but that's pretty common. Does anybody have GI? Oh, now you're pegged to the GI. So you have the stomach thing, and often these will be. So I would have a history. I would have all kinds of indications that I should check for this. Maybe he's got hip pain. Sometimes people with bad open ICVs stink. They just smell food, and especially the older folks. And so that you know something's not right. Something's getting where it shouldn't get. So, so I want you to take your hand, think of not a fist, but like lay that right over this right over the ICV. And that's positive TL. Now, it could be other things too. There's a lot of things there. That's how we would go about it. Now, a lot of times I might have, say, a weak iliacus, which goes along too with open ICV. That is weak. So I'm going to have you. Now, here's quick buzz on therapy localization. Therapy localization, you can do down open hand. You can do it with 3 fingers. You can do it with like a closed hand like this. It's like a stronger connection. You can also do it two-handed, which is a stronger connection than one. So I like this one because it's kind of like a two-handed TL, but it frees the patient's hand up for something else, like touching one of the other spots. So go ahead and actually no, let's not. Let's do the two-handed. We know that one works. So here's his iliacus, which is weak, and it strengthens to TF. Do we think he has an open ICV or closed ICV? back to a strong indicator muscle. Let's do that. Now go back again. Okay, so the strong indicator muscle weakens, the weak associated muscle strengthens. So those are two. Now I'm going to ask you to push in. So this tends to close the valve, and it re-strengthens. Now, while he's holding that too, does it strengthen the weak muscle that we came on? It does. Now I'm going to have you push down and holding both. This this opens the valve. Stick it open. We want it to be able to open. That doesn't strengthen. But it does weaken that because we're still TL. So push down and pull up. That's the one we want. This weak muscle, that's the one. So the other points I would check would be the shoulder and the left back. Is that tender? That's good. How about here? Okay. So how about here? So the other points with open ICV will be kidney 4, usually on the right, and bladder 58, usually on the left. Sometimes bladder 58. Closed ICV usually will be both bladder 58. But, yeah, you can see it. So those will TL. They will doctor TL. Go down here to kidney 4. I'm just touching it. And that gives us I can go to bladder 58 over here. So this one here. And so all of those. So I'm going to treat those points while he pulls that valve up. Put it in the position we want it to. And then we'll go down here. And I'm going to hold kidney 4 and the opposite bladder 58, even though I'm going to treat both of them. I'm just going to hold them there for a bit. Have them breathe. And then hold that. Holding that up towards the opposite. Some people, I'll do that. It's nice to be able to do the reflexes well. And they may feel like a little gurgly kind of thing happen after that reflex. Or not. What's that? It's less tender? Yeah. Okay. He's less tender? Yeah. If there's one, I'm going to do the other bladder. So you let that settle in. Now the indicators were the iliacs, which is strong. And the other indicator was strong muscle in the clear, which weakened to a TL. And it doesn't now. So what we can test, we've collected. She asked, check and see if it helped, because remember, he was still testing for stomach jam. Yeah, you need some visceral. Anybody working on you? Who does visceral? You guys learn What's that? Good for who? Cool. No, it's great. This one works great. Very rewarding. It takes patience. It's like training. Thank you. Yeah. So we're out of time. So